So in order to get the area completely numb, which we need to do since you're awake, there's a limit to the amount of lidocaine that I can give you. How many of those areas I could numb up at one time without exceeding your safe dose of lidocaine.
Hello and welcome back to another episode. I am Brittany, and today I'm going to be talking with you guys all about the story of Dr. Benjamin Brown. He was once a well-respected plastic surgeon in the Florida area. However, he is now being charged in the death of his wife, 33-year-old Hillary Brown. Specifically, he is being charged with second-degree felony homicide. This is manslaughter by culpable negligence. And so what this means is Dr. Brown should have known or did know that the events leading up to Hillary's death were likely to either cause serious injury or death. That is culpable negligence. Have you guys heard about this story? It is extremely shocking. And that's putting it lightly. But real quick, before we get into the video, I did want to say, if you don't already know, I am also the creator of the Brittany Holzbeck NP Review. It is the most affordable and comprehensive nurse practitioner boards review on the market. It is also accredited by the AANP, so if you complete the course, you are eligible to collect 15 continuing education credits. I have all of the information here up on the slide if you want to check it out. Just head on over to www.thenewnp.com. I'll also have everything linked in the description box below if you would like to go and check it out. But all right, let's get back to the video. When I was reading through this 30-page report, I was absolutely flabbergasted, and there is just so many wild things that I'm going to go over with you guys. But before I do want to remind you that everything that I'm going to go over with you has been pulled from very public sources, sprinkled in with my own opinions. I always recommend that you do your own research and form your own opinions. Also, Dr. Benjamin Brown, just like anybody else, does deserve the presumption of innocence. So he is innocent until proven guilty. Though he is being charged, he has not been convicted yet. However, it's pretty wild. So first, before we get into all of the crazy details, I think we should do just a really quick background on both Benjamin Brown and Hillary Brown. So Dr. Benjamin Brown, he went to the University of Texas Southwestern Medical School in 2005. He was valedictorian, meaning that he graduated first in his class of 232 students. And then after that, he completed a 6-year plastic surgery residency from 2019 to 2015 at Georgetown University. And then in August of 2015, he opened his own plastic surgery practice called Restore Plastic Surgery, located in Gulf Breeze, Florida. So Dr. Ben, he had 2 sons from a previous relationship before he met Hillary in 2021, and the two moved very quickly in the relationship because they got married in June of 2022. Hillary, she was 8 years younger than Ben, had 3 daughters also from a previous relationship, and she had her bachelor's degree in chemical engineering from the University of Mississippi. However, instead of using her degree, Hillary actually would go on to work at Ben's plastic surgery office, doing minor procedures, even though she had actually no medical training or licensure of her own. Hillary's dad, Marty Ellington, said that at first their relationship seemed to be positive and that Ben was very supportive of Hillary and really good to her daughters. However, he did say that the relationship turned and would eventually become pretty volatile between the two of them.
The hostility around there, it was just constant yelling, cussing, it was just a real volatile type situation.
And so this leads us to the timeline of events. So on November 21st, 2023, officers responded to Restore Plastic Surgery for a medical emergency. The patient, Hillary Brown. So she had gone into cardiac arrest after undergoing multiple cosmetic surgeries done by none other than her very own husband, Dr. Benjamin Brown. Although there aren't any technical laws against, performing medicine on family members, it is viewed as unethical and it is frowned upon. But Hillary was having multiple procedures done by Dr. Benjamin Brown. She was going to have a mini abdominoplasty, liposuction of both arms, ear pinning, and then a couple different injections on her face. all of which was going to be done on the same day within Dr. Benjamin's office. This was not like a surgical center or a hospital or anything like that. This was just his own private office. It's also noted that Hillary prepared her own IV bags before the procedure, and these were said to contain diluted lidocaine. Again, remind you, she had no official medical training, but it is said by multiple staff members that it was Hillary who prepared the lidocaine IV bags. And to be clear, lidocaine is not a minor drug. And this is going to become quite obvious as this case is further discussed. Lidocaine is used as an antiarrhythmic medication. We would occasionally use this in the ER during a code. It's definitely not one of the first medications they pull out, but it is a medication that we would use during this critical time because it affects the rhythm of the heart. So my point being is that lidocaine is not a harmless medication. Dr. Benjamin Brown, being a licensed plastic surgeon and a medical doctor, he knows this. He knows the risks that are involved, and so allowing his wife that had no medical training prepare the lidocaine is just absolutely reckless on his part and negligent. It's also said that at approximately 11 a.m., so this would be about 2 hours before Hillary's procedures, she took a handful of undocumented assorted pills. And then at about noon, she took 5 milligrams of Valium, 50 milligrams of Tramadol, 2 milligrams of Versed, 8 milligrams of Zofran, and 500 milligrams of Cefadroxil, which were documented. So she had the handful of assorted pills, which was not documented, and then that other handful of pills, which was documented. I'm sorry, what? I personally would be on my ass if I took all of this medication. Likely most of you, if you took all of this medication, would also be on your ass. That's a lot of meds. But what's wild is after she took all of this medication, she actually went into another patient's room to remove their sutures before having her procedure done. What was happening at this office? Then at about 1 p.m., they actually closed the office to the public, and the medical assistants got the procedure room ready for Hillary to have her procedures done. At which time it said that Dr. Brown actually took Hillary to mark her up for her procedures for like another 30 minutes. I thought that was interesting that they even made mention of that in the report. It seems like it's a little bit of a long time to make the marks on her. Who knows? About 30 minutes later, Dr. Brown came back in with his wife Hillary to do the procedures, in which case she actually took another dose of Versed. So your girl was drugged up. So the first of the procedures was the mini abdominoplasty. So Dr. Brown, he actually injected 600 milliliters of that lidocaine solution into her abdomen. And then in preparation of doing the liposuction to her arms, he injected 200 milliliters of lidocaine solution into each arm. So totaling 1,000 milliliters of that lidocaine solution that Hillary herself prepared. So this caused Dr. Brown to run out of the lidocaine IV bags. And so he requested that an MA went and get him more lidocaine, pour it into a bowl so he could essentially just draw it up as he needed. However, important to note, this lidocaine, however, was not diluted with anything. So this makes it even more potent. After Dr. Brown injected Hillary with that 1,000 milliliters of the lidocaine, he then performed her mini abdominoplasty. You guys, I don't mean to laugh because this is a really sad situation. Someone did lose their life. But would you believe it if I told you she then sutured up her own stomach? Hillary sutured up her own stomach. The heavily drugged, non-medically trained, non-licensed patient/wife of the surgeon sutured up her own stomach. What the heck was going on? I mean, can you imagine as the medical assistants, the staff sitting around watching? They had to have been just losing it, waiting for some kind of catastrophe to hit. And to be clear, Hillary was only technically able to suture herself because the lidocaine solution, it's meant to work locally. So this means that the patient is still intended to be awake, and only the areas that are involved in procedures are actually anesthetized. However, I'm using the term awake loosely because, again, she was clearly heavily drugged and in no way should have been performing any types of procedures let alone on herself, let alone on anyone, let alone without being medically trained. No one in their right mind would allow that to happen. But it was while Hillary was suturing up her own abdomen that she started to show the first visible signs of lidocaine toxicity. And so she started to have twitching in her feet and was experiencing some restlessness. Still, Dr. Brown carried on with the procedure and he actually finished the liposuction of both of her arms. In which case it said that he then took a break from the procedures before returning back to do the additional procedures on Hillary. So when he came back, like I said, he was out of the lidocaine that Hillary had mixed up in the IV bags. And now he just had that bowl of straight lidocaine that was not diluted that he was going to use for the procedures on her face. And so he started drawing up lidocaine from the bowl and he started injecting into her face. So he injected around her left eye first, and this is when she said that she was experiencing blurred vision. She was seeing like orange, having difficulty seeing. And so basically from the sounds of the report, he like manually opened her eye and said, "See, it's just because your eye is swelling because we're injecting fluid." And that is true. When you inject fluid into an area, it does swell up. Like blurred vision and seeing orange, he should have known that those were some really big red flags. But so she started complaining of those vision changes and he carried on still. So he now injected this more potent lidocaine into the area around her right eye. And this is when Hillary began to have convulsions and went into like a full tonic-clonic seizure. And this is said to have gone on for several minutes.
So in order to get the area completely numb, which we need to do since you're awake, there's a limit to the amount of lidocaine that I can give you. So we use a 0.1% solution, which will give you complete anesthesia or complete numbness, which is necessary since you're awake. But I can only give you so many milligrams per kilogram. In other words, I can only give you so much lidocaine based on your body weight. So I would need to weigh you and take a look at the areas you want treated to figure out how many of those areas I could numb up at one time without exceeding your safe dose of lidocaine. In general, most people can have 1 to 2 areas that bother them treated, but again, it depends on your weight and how big those areas are. We just have to wait for your body to metabolize that lidocaine. So generally, I would have people wait at least 2 to 3 days between treatments if they wanted to have it done under local. However, it's probably wiser if you need more than one area treated to just go to sleep so you can have it all treated at one time.
So I found this video incredibly telling. Dr. Brown knew of the dangers of overdosing with lidocaine. I mean, obviously, right? We would expect this of a board-certified plastic surgeon. But hearing him talk about his knowledge of the risks and what he does to prevent these negative outcomes, talks about not wanting to perform on more than 2 areas at once. He talks about how he recommends being intubated or put under if multiple areas are going to be worked on. He talks about the amount of lidocaine used and how it is weight-based and so on. Yet, he worked on multiple areas of his wife in one visit and injected her with very large amounts of lidocaine. So when I mentioned his charges in the beginning of this video, the manslaughter by culpable negligence, this is why. Dr. Brown knew that what he was doing was reckless and could likely result in a serious injury, even death of his wife, Hillary, but he carried on anyway. That is culpable negligence. Injecting unknown amounts of lidocaine into her face when she was already showing signs of lidocaine toxicity, which, by the way, a medical doctor and board-certified plastic surgeon, you better believe they know what signs to look out for in regards to lidocaine toxicity. Absolutely, a plastic surgeon has to know these signs of lidocaine toxicity. So what was happening that he was ignoring these red flags in his wife? Once Hillary started seizing, things went even worse because when she started seizing, the staff immediately wanted to call 911. However, Dr. Benjamin Brown said no and told his staff to wait. Instead, he asked his staff for a pulse oximeter, blood pressure cuff, stethoscope, oxygen tanks, and EKG leads. However, all that the staff could actually find was the pulse ox and a blood pressure cuff. However, none of these are actual medical interventions. They can tell someone that, yeah, this person's dying, but in no way are they going to help anyone save someone's life. And of course, when they placed these devices on Hillary, everything was reading low. So she had a low heart rate, she had low oxygen levels, she had low blood pressure. But still, like I said, this does nothing as far as interventions go. It only tells you that something's wrong. Other staff members went looking for other supplies, so like an AED. They went looking for a crash cart. They went looking for all of these life-saving interventions and supplies. And they weren't sure that the office even had them. And they were never able to find any of them. They couldn't even find a stethoscope. The man didn't even have a stethoscope. That is how unprepared he was for some type of emergency situation. And that in itself is completely negligent. To perform this amount of procedures on someone and administer this many medications and not have access to life-saving interventions is entirely negligent. And Dr. Ben Brown knows that. He has gone through significant education and training. He knows that that is entirely negligent and reckless. The staff watched as Hillary's heart rate declined, her oxygen level declined, her breathing became shallow. Essentially, Hillary was dying. And not until it's estimated between 10 and 20 minutes later did actually any interventions occur. So at this point, so like 10 to 20 minutes later, Dr. Ben Brown decided to finally initiate CPR and have someone call 911. However, by the time that Hillary actually arrived to the hospital, staff, of course, assumed lidocaine toxicity based on the story and her presentation, and that she had been without oxygen to her brain for too long. So right away, they had really slim hopes for Hillary's survival. And though she was placed on life support, this unfortunately only delayed the inevitable, and she passed away on November 28th, so just 1 week later. 2 days after Hillary's passing, an autopsy was done where it was confirmed that lidocaine toxicity was the cause of her death. And it was also confirmed that a drug overdose from the handful of pills that Hillary took, surprisingly, was not a contributing factor to her death. It was entirely because she had a lethal amount of lidocaine that Miss Hillary Brown passed away. Also, this is when it came out that this was not the first time that Dr. Brown performed procedures on his wife within the confines of his private office and experienced complications. So it's said that in January 2023, while performing a brow lift on Hillary, she seemingly overdosed on Versed. So the staff discovered Dr. Brown, he was yelling at Hillary to wake up, naturally, causing the staff to become concerned, but Dr. Brown assured them that everything was okay. However, he did continue to yell for Hillary to wake up, and the staff said his voice was increasing in urgency. It's actually said that Dr. Brown referred to Hillary as his little alien because of how much medication they would have to give her to properly sedate her. If this wasn't crazy enough, it is said that after Hillary passed away, the way that Ben behaved and the things that Ben was doing was extremely bizarre. So in a statement made by Hillary's father, Marty, Ben was very concerned about Hillary passing before November 30th, as this is when their employee benefits, such as their life insurance, would expire. And while everyone else in the family was holding on to hope that, Hillary would pull through, it's said that Ben was, quote, watching the clock, concerned that she may not pass away before that window of time was up. He was also on Facebook Marketplace at the time that Hillary was still in a coma. He was on there selling some of Hillary's things. So for example, here's a picture of Hillary's ski boots that he was selling. And in the description, he wrote, "Selling because my wife no longer skis." Well, no, Sherlock. Yeah, she's in the ICU bed with a tube down her throat. Yeah, she was in a coma and he was on Facebook Marketplace. It definitely shed a very poor light on Dr. Ben Brown. And so obviously then even more rumors and speculating happened. Also, since this has gained so much media attention, it's actually come out that Dr. Brown has multiple malpractice lawsuits out against him. 2 women have actually come forward and said that they received a Brazilian butt lift, so a BBL, when they didn't want one. What? Dr. Brown was quoted saying, "I thought you would like it," as if he had any right to perform procedures on women without their consent. Anyone without their consent. What an abuse of authority and power. I don't know if it was like his ego that had gotten to him and he just thought that he was above all of these protocols and safety measures and ethics, but so many things that he did were just completely negligent, reckless, unethical. I mean, the list goes on and on. So yeah, things could be getting a lot more serious for Dr. Ben Brown. On top of the charges of manslaughter, he could be facing some additional charges as well. We'll have to wait and see. Most recently, Dr. Brown was finally arrested. This was on June 17th, 2024, so pretty recently. The authorities, they said they had to wait, for the official toxicology and the ME reports, which do take time. However, he was able to immediately post the $50,000 bond, and so now he's just waiting, going to trial. His practice, Restore Plastic Surgery, it did abruptly close in November, following, of course, the death of Hillary, and his license was restricted. So as of May 2nd, 2024, Benjamin Brown can only perform procedures or surgeries in a licensed hospital while under the immediate supervision of another licensed physician. So just the idea that he can still perform, it's just a restricted license, I think is pretty lenient. That being said, if I looked at his LinkedIn, and it does appear that he's looking for work, which I don't know, I would feel like this might, taint your reputation. But I did see in the about section or whatever that he's looking to branch out from working in cosmetics. Probably for the best, Dr. Brown, probably for the best. In regards to my opinion, if you're curious if all of this is true, because obviously right now it's alleged and he, is innocent until proven guilty. But if all of this is true, I absolutely think that Mr. Benjamin Brown should be held accountable. It was ultimately Dr. Brown, who was the licensed physician, that had the knowledge and understanding of the risks involved. He is ultimately the one that's held liable and held to, a higher standard. Part of me wonders if he got so desensitized to working in the medical field and in a way kind of forgot the real risks involved with the procedures that he was doing. I'm sure he did these quite frequently. Sometimes you kind of just get almost in the habit of things and you forget how risky it is. Kind of like, when you're driving a car, it's so second nature. You're so desensitized to it. But there's a lot of risk involved in driving a car. Well, there's a lot of risk in performing surgery. Part of me also wonders if maybe Dr. Ben Brown was also using substances himself. I mean, in the report, they did say that all of the controlled substances were basically in an unlocked cabinet or drawer or something, but definitely not locked. And it was even said in the report that staff would often go and kind of have a free-for-all with these controlled substances to, quote, take the edge off. Maybe Dr. Ben Brown was using substances as well, which would maybe make sense as to why he was making so many poor decisions. Not that any of that makes it okay. I do wonder though, and I don't think he was ever drug tested, when they brought her to the hospital. I'm not certain, but from what I could find, it doesn't look like they ever even looked into it. Again, all speculation. It's just I just wonder. But I think that's going to be all for today's video. That was a wild one. I cannot believe it. I'm so sorry for Hillary's family. Her dad sounds absolutely devastated. I'm heartbroken for her 3 very young children that now don't have their mother. It's so sad to think about. Let me know what you guys think. Have you heard this story? It's a wild one for sure. But otherwise, as always, you guys know I wish you the very best. And I will talk to you soon. Bye.